I have a very special panelist with me today. He actually, Dr. Kenneth Campbell, DBE, MPH, MBA, MA, and I think if he gets any more alphabets in behind his name, he'll have the entire 26 letters covered at some point. But his title is that he is a former executive assistant to the director of the Illinois Department of Public Health and an adjunct professor at Malcolm X City Colleges. He also is a Marine Corps veteran times 6 years. And all I had to do at that point is say Semper Fi and say it in the correct way. And
Thank you.
he was an E4 financial records clerk during the Gulf War, Operations Desert Storm, and Desert Shield. But he also received his MBA and MPH from the Benedictine University and received his MA and doctorate degrees from Loyola University. In addition, he attended the Harvard T.H. Chan School of Public Health, where he received executive leadership training and certification. Dr. Campbell is someone I've known for some time. He is a stellar individual and is someone that you need to know. But he has done many things in the background for preventing the disease spread in in our city, in our state, and actually affecting all the states around us, so our nation, with the COVID-19 response. So he was working tirelessly around the clock. I can tell because he was calling me at 2 o'clock in the morning. I said, Ken, what are you still doing awake? And he was still out there working hard, working hard. But I have Ken coming on today, and there is an organization that actually I started back in August 8th of 2023 because I saw this lack of educational um, access for people who are in the African diaspora. So this organization, the African Diaspora Association of Public Health Professionals (LLC), but its mission is to advocate for and unify African diaspora public health professionals regarding STEAM education, AI usage, employment, and healthcare support systems ownership. And part of the problems that we have in our nation now is that we don't advocate for the education of people in general. So we have people who are across the spectrum from the veterans po- uh, population that are from the Army, the Navy, the Marines, the Air Force, who are in impoverished communities. So it's not just uniquely an African diaspora issue, but in order for us to have a unified nation and one that is built on strength, so we can stop all of this things that are going on with the violence, with the miseducation and misinformation about the culture mix that we have in this country, we need to highlight some of the achievements and some of the things that were done in order uh, to safeguard our nation. But from the perspective of emergency preparedness in particular, we had things that happened down in the Gulf region, Louisiana, with Hurricanes Katrina and Rita. Actually took about 600 soldiers down there to respond to that, and it was devastating in impoverished communities, and it was particularly um, uh, devastating in those communities of color that were there. But everyone who was affected by it is a person that's part of this nation that we should be protecting. But I wanted to talk to Dr. Campbell for his views on things like global warming, like infrastructure rebuilding, and the need for us to be pushing for people to become educated. I know he's at Malcolm X College. Um, that was a predominantly African American institution, but you had people from all nationalities, all from men and women. But I wanted him to speak to why is it so important for us to start learning about this infrastructure, the AI technologies, the need to be more engaged in STEAM, science, technology, engineering, arts, and mathematics, and to be more involved in the healthcare support systems ownership to make sure that we have representation in those systems in order to strengthen our nation. So maybe you can give us a perspective on what you see as the landscape and some of the challenges for getting involved in the infrastructure and into the technology realm and the educational realm, and how that overlay is so important for us for community engagement, those sorts of things.
Well, one of the things I think, Dr. Arnold, is that, and I know we touched on a little bit about emergency preparedness. And so when we look at disasters, disasters impact people and communities differently. Uh, and communities of color, as well as the underserved communities, disaster worsen inequities already present in society. And so when we begin to look at the many unique challenges and factors that stem from social determinants of health that goes unchecked before these emergencies arise, it really creates a huge problem when you try to tackle the social determinants of health and all of these other issues like misinformation and mistrust and distrust, which is a lot of this, as we saw during COVID-19. We really saw a lot of this in COVID-19. And so now that you added in the unchecked social determinants of health, the unique needs of minority communities, the underserved, the starve of resources that occur many times over, along with the barriers, then any kind of emergency in itself is like pouring gasoline on the fire. I mean, it just explodes. And so, as a result, what we need to be doing, and I really believe it is a governmental issue because this issue is not just isolated and in silos in one state or one community or one city, but it's huge and it's very impactful. So I think when you begin to look at a lot of these issues, I consider uh, emergency issues in the United States. We have to look at it from a more of a huge governmental issue coming in and trying to help us resolve these issues. Now, many would say, well, the government didn't do the best job for COVID-19. Understood. But when we have now with new technology like AI, we have access and opportunities to explore areas that we just could not have done before and really bring communities of color together and provide resources. I think the days are gone for us to have all of these conversations. We need now to move global as well as domestic resources into these communities to help deal with a lot of these social determinants of health that is really plaguing our community. So anytime a crisis come along or emergency uh, issue comes along, then it's almost again it's like pouring gasoline on the fire. We know the problem is there, but it's hard to do that from a community or individual level. You got to have the help of the federal government.
Yes, yes, and, first of all, I should have said "Simplify" when you first came on, and, "Hooah" for me, but "Simplify" for you. But, I was wondering, dealt with, people from, all the branches of the service, when you were doing emergency response work in Illinois, and what do you think, because when I raised my hand, to take this oath to the country, it was for every individual in this country, irrespective of their race, their religion, their gender. I don't care. I'm here to protect everybody.
That's
And
right.
so what is the role that we should be looking towards, and what do you think veterans should be getting involved in? Because many veterans are looking for, jobs, and they're looking at. We had someone on last week about from the Department of Labor, an assistant secretary who's over the veterans' jobs and those kinds of things. But how can veterans become more involved in this issue? I think there's a dire need there because of the training, because of the dedication and coordination that veterans have, for them to be involved in this whole process.
Well, I think it's like you said, we raised our hands and we fought
Mhm.
for the peace of this country so that we can have a country to come home
Mhm.
to protect Americans on American soil. And so it's a hard thing to ask now veterans who are soldiers who are veterans to continue to fight in this process. But we have to get involved. If we don't get involved, we're
Mhm.
not going to be at the table. And we have to be at the table. So
Yes.
there's a couple of things we need to do. One, I think veterans need to get involved at a political level. I
Mhm.
think we should, definitely communicate with our local politicians, our state, our federal, because they can provide the support we need, but also get involved with organizations that are doing the things that veterans need to have done. None of these things are done in silo. And so if there's a fire in one cubicle of the office, that fire can spread. So I think that all veterans, no matter what color we are, nationality we come from, we are all veterans, and we need to, uh, you know, come together and really begin to become part of the solution, because we can. We can. We have a lot of great politicians, elected officials who are doing a lot of great things for veterans, and we need to reach out to them and reach out to organizations that are really trying to change the landscape for not just veterans, but for their families, for their dependents. And so I think we have to be very proactive as veterans. I know it's a lot to ask after you have fought from the country and you may have a disability, but our voices cannot remain silent. We have to become part of the process and be at the table.
Yes, totally agree with that. That's something that I've heard echoed by, the VFW, Veterans of Foreign Wars, and also by the American Legion as well. That we are still community members and we have a role to play in society still. Maurice Bridges, who's the current VFW commander for the state of Illinois, it really echoes that, that we are veterans who are still have a purpose in life. As I was actually earlier, I was talking about this is suicide National Suicide Awareness and Prevention Month, and there are many veterans who have lost their focus on some things about how important they are, and I'm sure that plays into it a bit. But having a purpose in life is really important for them to have to see that they are still of value and still important to us. So we had many at the VA, psychologists and social workers on earlier, and psychiatrists that say that we have a significance, we have a role to play in the network of society. So what was your experience, working with veterans, and other people who are not veterans who are part of your emergency response teams? I know you have things that are going on, like EMACs that are going on, and all kinds of, other things going on. The Emergency Management Agency, IEMA, also is very intimately involved, as well as the Illinois Department of Public Health, which you are part of. So, what was some of the things that you saw as challenges in dealing with community members in a disaster situation? Because we don't really look at COVID-19 as a disaster situation, but it most assuredly was. We have a tendency to think only of bombs and buildings falling down as being, a disaster. But if you're interrupting supply chain lines and you'll get people are sick and you're overrunning your hospitals, that's a disaster. What is your experience, and what did you see, and where can we get better at making sure that people have inroads to care that they need, and also able to instruct them on being more resilient?
Well, one of the things I'm proud to say for Illinois, we had a great leader in Governor Pritzker. And I
Mhm,
can tell you that the Department of Public Health really stepped up.
mhm,
Did a fabulous job. They really rise above the occasion during this pandemic. And it gave me the energy as a veteran that we can do this. I think that a lot of veterans played heroic roles in getting out and helping us with a number of our vaccination sites, getting the word out, really penetrating into hard to reach communities. I think the thing that I think the pandemic really showed where we at in terms of how crippling our communities of color is, how minorities are right
mhm,
now. They've been suffering 1 through 18 COVID 18 for a long time. And so with this, again, when you pour this kind of gasoline on the fire, it only explodes and get worse. So I think that again, the government agencies from IEMA, the IDPH, Governor's Office did a fantastic job. The Illinois National Guard, um, and really veterans did a fantastic job and getting to hard to reach communities. Um, During times where there was no blue book.
Mhm,
And what we needed was a state to really step up. And I think the citizens did a fabulous job. Um,
mhm.
and I think we had a lot of coming together moments that really changed the trajectory of the COVID-19. We did have deaths, and that's the sad part about it. But as a state, we really stepped up and did a good job on that. Um, but it did leave minority communities at a disadvantage in a post COVID 19. A lot of the relationships that we connected, we have to make sure that those relationships are nourished, are have the resources in order for those relationships to grow, to mature. So if something does happen, we have that relationship. And I say we, I'm talking about government, talking about public health. I'm talking about organizations that really need to be in the community. You know, the faith-based community did a fantastic job as well. We did mega church vaccinations and testing all over Illinois. And so the faith-based community played a huge role in helping us with vaccination and testing. So I think that overall, um, we have to get all of these stakeholders continually be connected and in the communities, not just in crisis, but when things are going well. But these communities need resources. I mean, at the end of the day, that's what they need back. And that could be from policy, that can be building trust again, that could be removing the administrative roadblocks during emergency crises so
Mhm.
that these minorities can and people can just get what they need regardless of what community it is. They can just get through the bureaucracy and get the resources that they need in order to rebuild.
Yes, yes, and it's really important, I think, to the things that you stressed, and Governor Pritzker and Deputy Governor Juliana Stratton, they were really instrumental in making sure we secured and safeguarded people in our state. Many lives were saved by the efforts of the CDC, even though they were getting a bad rep. They did things that actually interceded, that saved and protected lives. And so I am really glad to have you on. I'm going to be bringing you back again, of course, Dr. Campbell. You know, all I can say is the Marine never goes away. They, they'll be part of my my group for life. But thank you so much for your insights, and we're going to be talking about a lot of historical things coming up on this particular segment. And so I'm really looking forward to having you as part of that in the future.